I wanted to review your most recent laboratory studies. Your complete blood count did not reveal anemia. The complete blood count is a simple blood test that measures the number of red blood cells, white blood cells, and platelets in the blood. It can check for anemia. It's a common test. It's used as a screening test that gives a picture of a person's overall health status. It can be used as the first step to screen for a wide range of medical conditions that include inflammatory diseases. We would need to check the complete blood count before starting medications. The chemistry profile was without electrolyte abnormalities. This test measures a variety of chemicals and enzymes in the blood to provide very general information about the status of organ health and function, especially the liver, kidneys, and pancreas. The profile includes the levels of sodium, potassium, chloride, carbon dioxide, calcium, proteins, liver function tests, and blood glucose. We would need to check the chemistry profile before starting any medication. The serum protein electrophoresis for protein elevation was normal. This is a laboratory examination of protein levels that commonly is used to identify patients with multiple myeloma and other disorders of serum protein. Elevations of these proteins have been found in persons with joint pain. The anti-neutrophilic cytoplasmic antibody. This is a test for vascular inflammation or inflammation of the blood vessels. It is a blood test used by doctors to help in the diagnosis of autoimmune disease. It is commonly elevated in patients with diseases such as granulomatosis with polyangiitis and Church-Strauss syndrome. Elevations of the antibody can be found in patients with joint pain. The uric acid level. This level was normal and it's a test for gout. It's also known as the serum uric acid measurement. It determines how much uric acid is present in your blood. This test can determine how well your body produces and removes uric acid. Most uric acid is dissolved in the blood, filtered through the kidneys, expelled in the urine. Sometimes the body produces too much uric acid or doesn't filter out enough of it. Hyperuricemia is the name of this disorder that occurs when you have too much uric acid in your body. High levels of uric acid are associated with a condition called gout. Gout is a form of arthritis that causes swelling of the joints, especially in the feet and big toes. The CPK. The CPK is a muscle test which was in normal limits. Creatinine phosphokinase, otherwise known as creatinine kinase, CPK or CK, is an enzyme which is that is found in your heart, brain, and skeletal muscles. When the muscle tissue is damaged, CPK leaks into your blood. Therefore, high levels of CPK usually indicate some sort of stress injury to the heart or other muscles. Elevated levels of CPK may be associated with muscle aches. The C-reactive protein or index of inflammation was normal. When there is inflammation in the body, the liver produces a protein called CRP or C-reactive protein. A high C-reactive protein indicates an inflammatory condition including infection. For this reason, a high CRP is not necessarily a strong indicator of RA or rheumatoid arthritis specifically, but can support the diagnosis. In addition to using CRP for diagnosis, doctors often use this test to monitor a patient's response to treatment. The serum ferritin. The serum ferritin was normal. A ferritin blood test can also help your doctor figure out whether your body has too much iron. High levels may point to alcohol abuse, infection, liver disease, rheumatoid arthritis, overactive thyroid, and some types of cancer. Serum ferritin, this is a test of how much iron is stored in your body. It can be a marker of inflammation, and elevated levels of ferritin with high iron levels may be associated with aches and pains. The iron levels were normal. This can show if you have too much or too little of a mineral in your system. It can check for conditions like anemia or iron overload. The types of iron blood tests include a serum iron, a total iron binding capacity, and unsaturated iron binding capacity. The serum iron measures the amount of iron in your blood. The total iron binding capacity measures how much transferrin is free to carry iron through your blood. If the level is high, it means more transferrin is free because you have low iron. Unsaturated iron binding capacity is a test that measures how much transferrin is not attached to the iron. Elevated levels of iron may be associated with arthritis. The TSH. This is a thyroid test and it was within normal limits. A thyroid stimulating hormone measures the amount of TSH in the blood. TSH is produced by the pituitary gland, which is located at the base of your brain. It is responsible for regulating the amount of hormones released by the thyroid. Elevated levels of this hormone may be associated with joint aches. The vitamin D level. This was in normal limits. Vitamin D is essential for strong bones because it helps the body use calcium from the diet. It's also known as the sunshine vitamin. Vitamin D is produced by the body in response to skin being exposed to sunlight. It also occurs naturally in a few foods, including some fish, fish liver oils, and egg yolks, and in fortified dietary and grain products. Low levels have been associated with aches and pains. The ANA, or anti-nuclear antibody. This is a test for lupus, and it was negative. This is a blood test that looks for antibodies to proteins found in the cell nucleus. The nucleus is essentially the brain center of any cell in the body. Many different types of proteins are found in the nucleus, and they all can be targets for an immune attack. The ANA is a test to see if there are antibodies in the blood that are attacking any proteins are found in the nucleus. The ANA is a screening test for autoimmune disease, including rheumatic fever, rheumatism, which includes such as systemic lupus erythematosus, and non-rheumatic diseases such as autoimmune hepatitis. It's not a specific test to a single disease. A strongly positive ANA makes it more likely that a person has an autoimmune disease. However, it does not distinguish between different types of autoimmune diseases. If the anti-ANA is positive, there are clinical features of an autoimmune disease. Other more specific tests will be ordered. After the blood is drawn, it's sent to a lab where it's diluted with saline solution and tested for the presence of anti-nuclear antibodies. The rheumatoid factor. It was negative. The rheumatoid factor measures the amount of rheumatoid factor in your blood. Rheumatoid factors are proteins produced by your immune system that can attack healthy tissue in the body. It's a blood test that looks for antibodies called rheumatoid factors. These are autoantibodies that are produced by the immune system that can attack a variety of healthy tissues in the body. The rheumatoid factor is usually ordered when a person is suspected to have rheumatoid arthritis or other rheumatic diseases. However, the rheumatoid factor is not a very specific test. In the early stages, about half the people will have a positive rheumatoid factor and the other half will have a negative. So having a negative rheumatoid factor does not necessarily rule out a diagnosis of RA. In established rheumatoid arthritis, 75 to 80% of people have a positive test. Once the test is positive, it rarely becomes negative unless the test was very low. The rheumatoid factor test can be useful in diagnosing rheumatoid arthritis. Since not everyone with rheumatoid arthritis will test positive, doctors interpret the results in the context of a person's other signs and symptoms as well as the results of other tests. The anti-CCP test for rheumatoid arthritis was negative. This is an antibody present in most rheumatoid arthritis patients. Levels of anti-CCP can be detected in a patient through a simple blood test. A positive anti-CCP test can be used in conjunction with other blood tests and imaging studies. The anti-CCP antibody is a blood test that looks for anti-CCP antibodies, which are also known as anti-citrullinated protein antibodies, or ACPAs. These are a type of antibody, which is an antibody produced by the immune system that targets something that the body's own tissues are made of. ACPAs target a type of protein that's called a citrullinated protein that can be found in some people's joints. This test can be helpful in diagnosing rheumatoid arthritis. They are present in 60-70% of people who get RA. Since not everyone with rheumatoid will test positive, doctors interpret the results of this test in context with their patient's symptoms and results of other tests. The SSA and SSB. The SSA and SSB antibodies for Sjogren's were negative. These antibodies can be found with Sjogren's syndrome, and is a condition characterized by dry eyes and dry mouth. There are marker antibodies for Sjogren's. 70% of patients are positive for SSB, and 40% are positive for SSB. It can be found in lupus patients. It is a blood test that detects human autoantibodies to nuclear antigens, SSA and SSB. The test can be used to support a diagnosis of Sjogren's. Joint aches have been noted with Sjogren's syndrome. Additional tests. If you're continuing to have joint aches and pains, I would like to obtain laboratory studies for celiac antibodies, Saccharomyces antibodies for Crohn's if you're having diarrhea or stomach pain, Lyme's titer